if you could just introduce yourself, your role with Mary's Place, your relationship to the organization, and how did you first get involved with Mary's Place?
Okay. My name is Joe Sherman. I am a pediatrician. I've been a pediatrician for about 35 years. And now I spend most of my time coaching physicians and health professionals in areas of well-being and career discernment. I also facilitate retreats and workshops in those areas. I do some clinical medicine still and just filling in for friends now and then. But my focus now in my career has kind of shifted toward supporting healthcare workers instead of doing the work myself. As far as my first involvement with Mary's Place, I think it came around 2013 or so. And there is a church in my community called Church of Hope. I live in the Columbia City neighborhood in South Seattle, and there's a community church that's a Lutheran church that has a mission to be all-inclusive and to bring everyone in. We were, as a family, had returned from serving in Bolivia with my wife, myself, and our two kids. And I was working as a pediatrician there for 4 years. And we found that this church provided a good home for us during that time when we returned. It was all inclusive, and we were looking for something that helped us to kind of live out what we felt would be our service that we would wanted to give to the community. At the time, Church of Hope was had signed up to be part of a network of churches in the city that hosted the rotating shelter for Mary's Place for families experiencing homelessness. I was working as a pediatrician at the time and had recently stopped working because I had become kind of disillusioned with a lot that was going on in healthcare. This was an opportunity for me to help volunteer to be a part of that shelter that rotated for about a week at a time. In the beginning, I was a volunteer who would just stay overnight, help with meals and so forth. Eventually, I became the coordinator for the church, and I would coordinate all the volunteers that were participating. As I was doing this work, I found out at the time Mary's Place included a rotating shelter that just housed perhaps up to 7 families at the most. And every week they had to move from one location to another. It was very arduous. They also had to find their own way every morning when they woke up. They'd have breakfast and then have to get on bus, public transportation to either go to what was then the day center, still is the day center in the same location on 9th Avenue. They could go there for the day and stay with single women experiencing homelessness that were there in the day. Or they could go wherever they needed to go. Kids had to get to school, various things like that. While I was working there, I found out that there was a small clinic in the day center, and they had volunteer physicians and nurses that worked there to try to provide some healthcare resources, some screening, some medical care. And I found that out, and I thought, wow, I would want to look into this and see if I could be a volunteer there. So then I started volunteering there. And at the time, Mary's Place consisted of the rotating shelter, the day center, and then there was another place called the Emergency Family Shelter, which was in an old warehouse, and Mary's Place and Union Gospel Mission kind of split the staffing of that shelter. That was for families that would stay, again, just overnight. They had to leave in the morning, and during the day they couldn't stay. And that's what Mary's Place consisted of at that time.
Great. Do you have a favorite memory of being at Mary's Place, a moment, interaction, or experience that really stands out to you among the rest?
Yeah, as I as I continued to volunteer at Mary's Place just in the day center and saw both adult women as well as kids that were part of families, Mary's Place started to expand and started to have 24-hour, they opened a 24-hour shelter that families could stay and actually receive services during the day. That was a huge step for Mary's Place. And that's where I could really expand my pediatric skills and start to be a part of that. Health services within Mary's Place started to expand as the number of shelters expanded. And we, instead of having a part-time nurse along with some volunteers that would help, we started to have kind of more permanent staff. So I increased my volunteering, and especially when we started to do day centers, I'm sorry, 24-hour centers for families, and then eventually became the health services director, I believe in 2017, during that time. I think um, some of my favorite stories early on had to do with the women that were in the day center. And, I'm a pediatrician, and I'm not used to taking care of a lot of chronic illness in adults. And most of the time I was referring people, screening them and referring them to primary care providers. And I just remember the characters that I would run into. And many of them were suffering from mental illness and some from addiction. And sometimes I would sit there and listen to their stories in the clinic office. And I would think, oh, this person is delusional. They're going off and all these different tangents. But then they would start to tell things that were like, wow, wait a second. They really did work for the government. They really did work for this particular government agency or whatever it was. I thought that they were just delusional, but I think that those some of those encounters I had where people would come in, and the wonderful thing about it was that I had as much time as I wanted with my patients. So I could sit there for 30 minutes, an hour with one person and be able to just listen to them. And that's all they were looking for. They were just looking for someone that would listen to them no matter what they had to say, non-judgmentally, and then explain to them what it is that is going on, if there is something going on medically, because the treatment that they received in emergency rooms and in sometimes in other clinics and so forth was so dismissive that they were just looking for respect and trust. So I think that those were the early days. And then later on, I think my fondest memories were that when we really had a staff, when we could provide programming and this type of wraparound services for families and get services for especially children that had complex medical conditions. That's something that, for me, being a part of that expansion and part of that is something that I'll always remember.
Mhm. During your time at Mary's Place and with them, what impact did you see the organization having in the more general community?
Well, I think during my time with Mary's Place, I have to say that, and I think this is still true, Mary's Place is the premier. At the time, they were the only organization that was sheltering whole families and keeping families intact. Uh, Definitely when we started to house both parents with kids. So it wasn't just single women with children. It wasn't just, so that's where I feel like Mary's Place, at least in this area and nationally, has been a pioneer in how to provide what I believe to be inclusive and culturally sensitive shelter and services for families experiencing homelessness. So there were plenty of organizations that were providing shelter overnight, especially for adults. But I think when Mary's Place started to provide those wraparound services and 24-hour shelter services, that was really, for me, that's their biggest impact is how to do that on a scale that is comprehensive and and really is willing to grow and change, I think, as according to the needs of the people that they're serving.
Mm-hmm. And how did you see Mary's Place change over your time there?
I think the biggest changes that I saw were when I first started to volunteer with the rotating shelter. Mary's Place staff consisted of a handful of people. That's it. And then a bunch of volunteers. And I just remember that it was kind of like if you were working in the rotating shelter with these families and something went wrong, it's like, well, who do I contact if I have a question? And they would say, Marty Hartman. It's like, she's in charge of she's the director. It's like, yeah, well, we only have 3 people. So she's the one you would contact. So that would be it. So it was this just tiny operation in the beginning. And then it really expanded. And I think as it expanded, we had growing pains that, believe me, I was critical about some of the things because I felt like sometimes we grew too fast. And many times we said, I would hear, we've decided to try to make sure that we have the infrastructure in place before we grow anymore. But then the need was there. And very often it's like, we can't say no, we have to keep going. So sometimes it was exhausting just to try to keep up with the expansion. I think for me, I always was pushing for, as best we could, to provide 24-hour access to families because I hated to put whole families with babies, out on the street during the day. And so for me, that was one of the biggest breakthroughs, is to really move the emphasis to 24-hour services.
Mm-hmm. So my last question, just for the interview today, is what was one event, or if you can't think of one event, time period that you think is particularly important to the history of the organization?
I think the Sentinel event, I think for me, was the opening of the first 24-hour family shelter, which was the North Shelter off of Aurora Avenue. That was the Sentinel event, because then that set the stage for the future of 24-hour services for families. So that was something that I would say was huge. And then I think another event or movement was to actually expand health services, because that was my association was within health services, to expand health services to include permanently employed staff, as opposed to just working with a bunch of volunteers. So that was, and then I think the establishment of Popsicle Place, because that was where we really started to make a commitment to children with complex illnesses and their families, and trying to provide a place for them. So I think I gave too many answers to one question.
That's all right. That's perfect. So that's all the questions I have, but if you have any other stories or memories that you want to share, that you want to be included in this, feel free to share them now, or if you can't think of any, also feel free to reach out to me and I'll make sure they get in there somehow.
Yeah, I think there, I have to tell you a story that happened actually recently. I was working as a volunteer preceptor for the University of Washington's School of Medicine, and they have a mobile street outreach clinic. And it was on a Friday night, and it was in the University District. It was cold and it was rainy, and I was out there helping medical students. And an older woman came up with a walker, and she had many of her belongings kind of attached to her walker in bags and such. And she was moving along, and she was smiling and cheerful and talking quite a bit. I was cold and freezing and, and trying to do whatever I could to help. And we were able to bring her up onto the van to try to talk with her. And as I spoke with her, I had the name tag on that said Dr. Joe. And then I kept looking at her and saying, gosh, she looks familiar. I don't know where. And as we started to talk, and I started to talk to her, and she started to gain a little trust, it was at one point I asked her for her name if she was willing to tell me, and she told me her name. And then she looked at me and she looked at my name tag and she said, "Are you Dr. Joe from Mary's Place?" And it was in that moment that I recognized her as one of my patients from early on. I would say probably 10 years earlier in the day center at Mary's Place when I was just starting as a volunteer. And she said, "I will always remember you for the way that you listened and you cared for all of the women that were there." And it was a night and a time in my life where I was kind of feeling, um, where am I meant to be in this world? And it was as if she was sent to me that night just to say, you really did make a difference, and Mary's Place really made a difference in my life. And it was that's where she received compassionate care.
Thank you. That was a wonderful story. Thank you for sharing.
Sure.
And thank you for participating in these interviews. I've really enjoyed talking to you today and hearing your stories and hearing your memories. They were really wonderful. So thank you.
Thank you, Colette.